Drugs used to treat constipation and diarrhea. The objectives: identify the drug therapy for constipation and diarrhea, identify the drug class laxatives, identify the drug class antidiarrheal agents. What is constipation? Constipation most commonly occurs when waste or stool moves too slowly through the digestive tract or cannot be eliminated effectively from the rectum, which may cause the stool to become hard and dry. Chronic constipation has many possible causes. It may result from decreased motility of the colon or from retention of feces in the lower colon or rectum. In either case, the longer the feces remain in the colon, the greater the reabsorption of water and the drier the stool becomes. These are the common reasons of constipation. We have the lack of fiber in the diet, overuse of laxatives, stress, some medication, changes in routine. Lastly, low physical activity. Treatment of constipation. First, change what you eat and drink. Changing what you eat and drink may make your stool softer and easier to pass. Second, get regular physical activity. Third, try bowel training. Fourth, stop taking certain medicines or dietary supplements. The last one, treatment may include food high in fiber, non-stimulant laxatives, stimulant laxative, enemas, suppositories, biofeedback training, prescription medication, and surgery.
So now, what is diarrhea? Diarrhea is a loose, watery, and possibly more frequent bowel movements is a common problem. It may be present alone or be associated with other symptoms, such as nausea, vomiting, abdominal pain, or weight loss. Luckily, diarrhea is usually short-lived, lasting no more than a few days. And also, diarrhea is an increase in the frequency or fluid content of bowel movements because normal patterns of defecation in the patients may be caused by intestinal infections. So, intestinal infections are most frequently associated with ingestion of food contaminated with bacteria or protozoa, or with food poisoning or eating or drinking water that contains bacteria that is foreign to the patient's gastrointestinal tract. Usually, people can get intestinal infection through street foods. So the next is spicy or fatty foods. Spicy or fatty foods may produce diarrhea by irritating the lining. Is drug therapy. Diarrhea is a common side effect caused by the irritation of the gastrointestinal lining by ingested medication. Diarrhea also results from the use of antibiotics that may kill certain bacteria that live in the gastrointestinal tract and help digest food. The next is the emotional stress. Emotional stress can cause diarrhea is a common symptom of emotional stress and anxiety. The next is hyperthyroidism. Hyperthyroidism can cause diarrhea. It can induce increased gastrointestinal motility resulting in diarrhea. Next is the inflammatory bowel disease. Inflammatory bowel diseases such as diverticulitis, ulcerative colitis, gastroenteritis, and Crohn's disease cause inflammation of the gastrointestinal lining, resulting in muscle spasms in diarrhea. And the next is the surgical bypass. Surgical bypass procedures of the intestine often result in chronic diarrhea because of the decreased absorptive area remaining after surgery. It completely digested food and water rapidly passed through the gastrointestinal tract. Drink plenty of liquids, including water, broths and juices, Avoid caffeine and alcohol. Add semi-solid and low-fiber foods gradually as your bowel movements return to normal. Try soda crackers, toast, eggs, rice, or chicken. Avoid spicy foods, fruits, alcohol, and caffeine until 48 hours after all symptoms have disappeared. Avoid chewing gum. Avoid milk for 3 days after symptoms disappear, but you can eat yogurt.
Laxatives. So the products under laxatives are Agoral. It is used to treat constipation, may also be used to clean out the intestines. This laxative works by keeping water in the intestine, which cause movement of the intestines. Next is the citrate of magnesia. Is a saline laxative that is thought to work by increasing fluid in the small intestine. It is usually result in a bowel movement within 30 minutes to 3 hours. Next is Fibercon. It is bulk-forming laxative that increase the amount of water in your stool to help make them softer and easier to pass. Golitelli. It is a solution that stimulates bowel movements. This medication also contains mineral to replace electrolytes that are passed from the body in the stool. Helis MO is used for hyperacidity and excess acid in the stomach. Last, Pericolase. This product is used to treat constipation. They works by keeping water in the intestine and helps to cause movement of the intestines. Anti-diarrheal agent. Generic name. Systemic action diphenocine. Brand name Motofen. It is used as an adjunct for the management of acute non-specific diarrhea and acute exacerbations of chronic functional diarrhea. Generic name Comforted tincture of opium. Brand name Paregorip. It is used in the treatment of diarrhea. It is also used to decrease movement of the stomach and intestinal muscles. Generic name Local Action Atapogate. Brand name Kaupectate. It is used to treat diarrhea, nausea, and upset stomach. Generic name Bismuth subsalicylate. Brand name Pepto-Bismol. It works as an Bismuth subsalicylate. Brand name Pepto-Bismol. It works as an antacid to reduce excess stomach acid and so ease discomfort. Generic name Atapogate. Brand name Paripectoline. It is like a clay powder believed to work by absorbing the bacteria or germ that may be causing the diarrhea.